Hi everybody. Thank you all for coming on. I know it's quite late, so I'm not going to be a long time, but I'm really excited to share with you my case study using the Jalupro products. If you haven't seen it already, I can send you the case study and it has the protocol to use all the products in the Jalupro range. This case study won an international award. So for those of you who missed it, it was in Athens last year. And Acre Pharmacy, wonderful pharmacy, were able to take me to Athens and yeah, we won a case. I won the award. So I'm really excited to share with all of you my case study. So I think we'll just wait for a couple. Emma is here from Acre Pharmacy. She's come to support and just go through some training later on if anybody's interested to do some training in Jalupro. So we can hop on at the end and she'll give you some dates and some times available to do some Jalupro training. I think, should we start, Emma?
Yeah, I think we'll start now. Kelly did so well winning this award. I'll share my screen. Yeah. Can everyone see the screen?
If anybody's got trouble seeing the screen, just type in yes or no, or just hop on and say they can't see it. So this is just a little bit about me and how I came across Jalupro in clinic. So Acre Pharmacy did a drop-in visit and said, Kelly, we need to start thinking about giving some amino acid replacement therapy. So I really struggled to see where it fitted into the clinic, but actually it fit in with every injectable that I did. And it's really important that to add Jalupro into every injectable that you do because you're looking at the patient holistically. And we always talk about consultations and how we do consultations and how we look at things like health, skin, aging. We're looking at the patient's diet. We're looking at how much water they're drinking, how much skincare they're using. And what we're trying to do is stop the aging process. But again, scientifically, we cannot stop the aging process. But what we can do is we can give you the tools to replace what you've lost collagen-wise and amino acid-wise. So this is where Jalupro fits into your clinic. So I'm just going to talk about a little about me and a bit about my background. I am a nurse prescriber. I have been qualified since 2012. I did my anaesthetics in Salford University, and then I did my prescribing course in also Salford. So yeah, I've been around a long time in the aesthetics industry. I did my original training in Skin Viva with Dr. Tim Pierce, and it was really nice to meet up with him last year at Athens. And yeah, it was really, really exciting. So I've actually had my own clinic for 2 years when I left the NHS. So yeah, I'm super excited to go through this case study with you now. So if I just hop onto the next slide. So Jalupro, what is Jalupro? So there is no other biostimulator on the market that offer the same approach to Jalupro. So it offers consistency throughout your patient's journey. So we're always thinking about amino replacement and amino acid replacement and collagen. So as we all know that we age, naturally, and we're losing around about 1% of collagen from our 20s. So by the time we've hit the age of 40s, 50s, we're losing a lot of collagen. So we're looking at people are getting smart now. They're thinking about replacing the collagen that they've lost. So how do we do that? So we look at things like amino acid replacement therapy. We look at collagen replacement therapy. We look at stimulating the skin and the fibroblasts. So Jalupro can be tailored and incorporated to any injectable that you do in clinic. And it's really important to understand the science behind Jalupro and how it gives you the tools to give that amino acid replacement and that collagen replacement. So in your consultations, you need to be looking at the science and make sure that the patient understands how Jalupro can improve skin laxity in your clinic and how it can be incorporated into their skin routine. So we're going to talk primarily about injectables and the range of Jalupro products that are available to be injected. Now, first of all, I would just like to show you before and afters. Now, this patient received no hyaluronic acid filler. This is all results given using the Jalupro range. So, first of all, what we did is we targeted the ligament. So the ligament is what holds up your SMAS. It gives structure, it contains volume. You've got your fat pads, your skin, your collagen, everything that's needed to give you really tight skin and firmer skin. We need to be looking at the density of the skin. So what we first did is we give 4 sessions of the Jalupro Super Hydro. Jalupro Super Hydro is an amazing product. It is the only biostimulator on the market that delivers right down to ligament. And essentially, that is what you need. You need that product to be going straight down to ligament, straight off the periosteum, straight into the ligament where that is needed. This will give the client and the patient an amazing support to the ligament. We recommend 3 to 4 sessions of the Jalupro Super Hydro. There is the 6-point injection technique, and it's super easy, and we'll send you that protocol if you want later on. Next, what we did is I'll just go back and I'll just talk about this patient. So this patient, she had no previous filler, no injectables whatsoever. She was just using her skincare. So we actually stopped her retinols 2 weeks before any injectables, and we had a look at what Fitzpatrick she was. So she was Fitzpatrick type 2. She was an ex-smoker. She was 61 years old. She found she was lacking in confidence perioral. So what can we do to give her some support? So we decided to give her on a treatment protocol, which included giving 4 sessions of the Jalupro Super Hydro. Now, again, going back down to the ligament and supporting the ligament with amino acid replacement. So we did 4 sessions of the Super Hydro, and I will send you the protocol later on in this, after this has been completed. So here is the protocol that I used to achieve these results. So like I said, Jalupro Super Hydro, 4 sessions, 6 points of injections using the 0.2, and we did 1 point at the chin with 0.1. So then we went on to Jalupro Classic. It is an amazing product, Jalupro Classic. You can use micro droplets. You can go into the SMAS. It's an amazing, amazing product that will stimulate the fibroblasts and give you that amino acid replacement, which will improve collagen as well. All the injectables will cause trauma because they're injectables, and with trauma comes collagen. So all these injectables, we're promoting collagen, even just giving the injections. But not only are we promoting collagen, we're actually replacing amino acids, which again, you will have slight downtime. So we incorporate LED therapy into all our injectable sessions at Skin Aesthetics. So it's really nice. We consult with the patient, we do the injectables, we then pop a lovely Jalupro face mask on the top, and then we put LED light on. So the patient's really, really engaged. They're feeling that they're having injectables, they're having a really nice face mask, and then they're having LED therapy. So you can incorporate all LED devices into these injectables, which is really nice. It makes your patient feel like they're receiving a really luxurious treatment, and with good effects as well. So with going back to Jalupro Classic, you actually make Jalupro Classic. It comes in a powder form. And again, I use micro droplets, around about 1.5 mils each session. We did 4 sessions, and I went all around the perioral area. You can actually use this in the SMAS and use the cannula as well if you want to. If you can use it really superficial as well, which really you can almost see straight away the skin laxity tightening up. It is an amazing product, Jalupro Classic. So HMW. HMW is really good. We can use it in the neck, we can use it in the neck, we can use it in the face. So I tended to focus more on lips with HMW. It's our patient Claire, she wanted some volume in her lips but didn't want to have filler. So Jalupro HMW is a perfect product to use. It does have some low molecular weight in there, so it really gives a slight bit of volume, but really focused on the wrinkles around her vermilion border. And if you go back to the slide where you could see her before and after, you can see there was a huge dramatic change in the structure of the lips. They seemed more fresh, they looked more hydrated, they looked firm, as opposed to when we had a look initially. So during all of these injectables, we recommended Claire to be taking Jalupro supplements. So if you don't have Jalupro supplements in your clinic, we would definitely advise you to do that. We can offer patients Jalupro drink sachets. We can do face masks. They also have little what they call.
We've got supplements, we've got they're almost like shot drinks, which are amazing, so you can incorporate them into your daily smoothie, or whether it's just you want to have it on its own. We've got a protocol for the consumables, and to be honest, they are amazing for that, like Kelly said, just like that holistic approach and making sure that you're continuing that amino acid replacement therapy, getting in your peptides and your amino acids at home, and there's been some great results from the consumables.
So why choose Jalupro over other products on the market? Jalupro is the only product on the market that has amino acids, peptides, and HA properties. So when I talk about HA properties, we're talking about high and low molecular weight. So this is going to give firmer, tighter results quicker for patients. So it's really important that you understand the patient's history and what they're doing at home. So I always talk about Jalupro. They're coming in for a gym session. So they're coming in to me and they're coming into clinic and they're having a little PT session with me, but they need to be continue their supplements at home. So they continue the journey using Jalupro to get the maximize their results. So as you can see, our patient Claire was over the moon with the results. Her whole perioral area was lifted tighter. Her skin laxity was improved dramatically, and she felt amazing. As I say, we use the Jalupro face masks and the LED in each session. So to maintain these results, we would go on and give the patient further Jalupro HMW, approximately around about 6 weeks apart. So we would keep on, we would maintain the Super Hydro every 6 months. Claire's actually been in for another 4 Super Hydros and Jalupro Classics, just to maintain her perioral area. It's, as you can see, it's an amazing product, and we're so excited to showcase this case study with you. So over to you, Emma.
Hello. So thank you everyone for listening. Like I said, Kelly has excelled with this study. I was in where were we? Athens with Kelly when she won the award. So she's honestly done an amazing job, and I'm sure you will see her a lot on our socials. As Kelly mentioned, I think obviously with being the official distributor to Jalupro, there's a lot more than that we can solely offer than just the products. You know, we provide a lot of support, and it's actually been a super exciting week because Arena has joined as brand manager. So the team has actually grown, which is super exciting. So she's got loads of experience globally, and we'll be there to support with all things like materials and what we can basically do to support you with the clinic outside of just the range. I'm biased because I've had Jalupro. I love Super Hydro. It's just amazing for, you know, any patients, any age. So I'm blabbling on now because Kelly's kind of just took us through, but I think it'd be really positive as well to kind of finish off with some other news. So we've actually partnered with the Lamb Training Academy, who are based in central London. So we would absolutely adore if we could get some of you on some dates for London training. So I know a lot of you may have been on our trainings before, but what I can do is I'll pop the link either in the chat, or I will get our amazing marketing team. I'm being like, but it's like gloating about us all now at Acre, but I'll get someone to send over a link so you can easily book onto training. I think the first one is on the 29th of March, but there'll be lots more dates being posted. So the Lamb Clinic is with Dr. Tara Francis and Dr. Wazim, so we're really excited about that. And now super invested with the Jalupro range as well. I'm sure you can keep your eyes peeled as well for lots more case studies, and also more opportunities to be part of case studies, because brands that we work with, such as Jalupro, do actually have case study competitions, things like that. So Kelly has done an amazing job. So I'm sure we would love to see some more case studies across the board, because I think the world's your oyster with in combination treatments. You can mix it. We've got people mixing it with polys, devices. I think combination is key, and I think the wave of regenerative medicine is so exciting. So we can definitely get some more case studies on the go and share more of those with yourselves. So I can actually, if anyone, we've allowed it so that you can do a Q&A. So if anyone does have any questions, if we just open ourselves up for a few minutes, just if you've got any questions, and then yeah, and then hopefully we've covered everything. We've got a little stop sharing. Can you hear us all okay?
Yeah.
Yeah. If anyone's got any questions, I can't. Has anyone put anything in the chat? Oh, here we go. There's a lot of questions in the chat. What ligament are you talking about? Can I see images of the client? What is in the Jalupro sachets? Can't see the slides, nothing's showing. Oh. Can any be used in the BAP technique? So yeah, a lot of them can be used in the BAP technique. We can actually send over the brochure, because obviously when I'm talking about medical, Kelly will be your best bet, but we've got the Jalupro range amazing. We've got full brochures with kind of all the key information and protocols.
So the BAP technique normally goes with Profilo. So Profilo doesn't go down to ligament, so you can't compare it. So it's very similar to the BAP technique, but you're actually injecting into ligament rather using a standard technique. For everybody, you can actually go down to ligament with the Jalupro Super Hydro. So we would send you the protocol, and when you do training with Jalupro Super Hydro, we give you hands-on training where the ligaments are and where to inject. So again, they vary from patient to patient. However, you know, yeah, I'll get Emma to send you the protocols, and you can actually see the 6-point injection with regards to Jalupro Super Hydro.
Because not everyone's, I think as well, it's not a one set protocol, because I think everyone's ligaments, I'm not obviously speaking science, but I know everyone's fall slightly differently. So
will the protocols be available?
The protocols will be available at ACE and will be on stand, especially with the rest of the Jalupro team who can go more into that. I think it would be best as well with the ligament protocol, just because I don't want to get anything wrong, to send it over on as a PDF as part of the protocols, because I think it's all part of the training. So I think it would make more sense to, rather than blabber on about, get it straight, so that it's quite a, obviously it's quite a unique product in the ligament. So I want to get that right.
Absolutely.
We will be at ACE as well, so we're on stand GH19, so we're in the Platinum Hall. So we're newly partnered as well with Galderma. I think a lot of our friends at Teoxane, Dermafocus will be there, as well as Jalupro. We'll have Arena, who's the new Jalupro brand manager, on stand as well. So I think it'll be super positive. Anyone that's there, I'm called Emma. Obviously Kelly might be attending ACE as well, I think. So any questions, feel free.
Can I ask a question? Sorry, I'm trying to put something in the chat, but it's not allowing me. My name's Kirsty.
Oh, yes, of course.
Hi, sorry, quick question. So I have a client who's got Ehlers-Danlos syndrome,
Okay.
has a mollusk allergy. So I've decided that polymyx is not a good idea, because I do not want her I think she says it's purely mollusk, but I'm not willing to risk it. So I was told that Jalupro would be an option, but with Ehlers-Danlos syndrome, am I going to get much of a result? Because her ability to have any collagen in her is just, I mean, it's very limited. She has it quite severely. So I've been trying so hard to find out about this, but it's been really difficult.
So Jalupro gives you the tools to regenerate your own collagen. So she's going to really struggle with that. But what it will do is we'll give her lots of amino acids. So she will have an improvement just with the amino acids. So I really wouldn't, you could say to the patient, look, talk about achievable results. Say, listen, X, Y, and Z is not available to you because of whatever reasons. However, let's give Jalupro a go. I would absolutely recommend using the Jalupro Super Hydro and the HMW because that has got the most peptides and the amino acids over the Jalupro Classic. So it's definitely worth giving her a couple of sessions and see how she responds to that session and go from there.
I've got HMW to use on her, so I thought I'd try that first.
HMW is, people say, well, where do I use HMW? You can literally use it everywhere. You can use it in a bleb, you can use it quite deep. You can, I've used HMW in a nasolabial fold, a standalone marionette. It's so pliable, so you can, you can literally use it on the whole of the face. Is there a particular area that she's concerned about on her face?
She's concerned more about her neck than anything. So her face actually isn't too bad, but she's quite concerned about her neck. Not down to décolletage, but just around her neck, really.
And is it crepey skin or lax skin?
Lax.
What she presented? Okay, so I would absolutely use Jalupro Classic, use a bleb technique, I normally go across here, 10 blebs, and I do about 6 rows. Then I use the face mask, even though it's for the face, I actually pop it on the neck just to give it that downtime. It'll cool the neck, and then pop her under LED therapy, red light therapy, just for inflammation, and it will stimulate all them amino acids and collagen to work. So I would absolutely give her a session and see how she responds to that.
And do you think maybe supplements might support that as well?
Absolutely. I tend to put my patients on 4-week supplements before they receive any Jalupro injections. Obviously, they benefit. They've got some collagen and amino acids on board before they actually have the injectables. And it's really important to look at their diet, look at their water intake, look at their skincare at home. Make sure they've got a really good routine so that they're supporting all the injectables that we're giving them.
That's fab. Thank you so much. That's really helpful.
No, you're very welcome.
I'm just going to try and pop in the chat as well. I've just made a wee transfer with the brochure in. So I'll just pop that in the chat now for everyone to download.
Also, the protocol is on my slideshow. So if anybody wants my slideshow, just email Emma and she'll send it across. You're more than welcome to use the images. And if you just want to print the protocol off, it's there in clinic for you to follow.
I think that's about the HMW being used around the mouth and the smile lines and everything. I think that was one of the main points of your study because your patient was a smoker. So I think that was really key, wasn't it?
Although we can see a case study results, it would be really good to know exactly what was used. So I used the whole range. So I used Jalupro Super Hydro 4 sessions first, then I went on to HMW, and then I went on to Classic. So Classic is where we saw the most results because it was one of the end products used. So we already had the amino acids and the peptides on board. Then we went on with the HMW. So when we did the blebs with the Classic, all around the periorbital area, I literally did blebs all around here, all around the marionette lines, nasolabial folds. I even went into the chin and the upper lip lines. And then I went into the vermilion border with the HMW to give it that volume. So I used all these products and they're on the protocol.
That one would probably be the Jalupro Classic, wouldn't it?
Yeah, so across the forehead, you would use Jalupro Classic.
People have done some interesting studies as well on Jalutox. So toxin and Jalupro, so that's another good protocol.
Yeah.
As well, I think it might be interesting just before we wrap things up to just tell everyone a little bit about how you price Jalupro within your clinic, and just a bit of advice on how to position Jalupro from a business perspective.
Okay, so Jalupro is a perfect product for patients who don't want, they're scared of hyaluronic acid fillers, so they fit nicely as a bridging gap between non-injectables and injectables, because you're explaining to the patient that, look, we are replacing what you've lost in amino acids. We are going to give you tighter, firmer skin by giving you this product. It is injected, so you receive the full amino acids. So lots of my patients will come in and be like, Kelly, I've spent thousands of pounds on collagen supplements. Amazing. But they're not actually receiving 100% of that product, because, as we know as prescribers, by the time that your digestive system, they've actually destroyed most of the collagen that they've taken orally. So by injecting the product, you are receiving 100% of that amino acid. So you almost have to explain to the patient the science behind how you receive the product is the better the outcome of the results that they want to achieve. So I think it's really important for them to understand receiving injectable actually, and they're not going to be changed the way they look, because we're not actually giving them hyaluronic acid, which is HA-based filler. We're giving them amino acid, so we're tightening what they've got already. We're not actually replacing volume with hyaluronic acid. So once they understand that train of thought, then they tend to think, well, actually, they're not going to look volumized with lots of hyaluronic acid. My skin's going to look healthier and tighter using an amino acid replacement therapy. And what you'll find is that patients come in, and once they start on Jalupro, they will continue to use it. I use Jalupro injectables in all my toxin patients, in all my filler patients, because they'll come and have a nasolabial fold filler or a marionette filler, but we want to keep the longevity of them fillers as best we can. So we give them a course of Jalupro Super Hydro on top of their filler, or HMW. Everything, give them the tools to keep that filler in best condition. So it can be incorporated to all patients in all injectables. I price my Jalupro Super Hydro so I do a 3 sessions for £600, and in that £600 they have their 3 mils of injectables. There's 3 mils in a Super Hydro syringe, so they get 9 mils of Jalupro Super Hydro. Then they receive a face mask after each injectable session, and then they receive light therapy as well. So they tend to be in clinic around 40 minutes to an hour. And like I say, because we've got that injectables, and then we do the face mask, and then we do the light, they find it's a really luxurious treatment to receive at clinic.
The other thing I was going to just touch on is someone's asking to clarify your protocols. I've got it up here. So it was Super Hydro 4 sessions, 2 weeks apart, and then it was I support the ligaments.
Then we'd use HMW.
Yeah. Jalupro Classic, and then the HMW, and then it was the food supplements.
Yeah.
So all Super Hydro, ideal, obviously for any Jalupro, it'd be great if you can get patients about 2 weeks apart. Some of the treatments can be used in the same session as dual layer approach. Obviously, if your clients can't get back in with 2 weeks, you can adapt the protocols to whatever suits. But for the best results, obviously, it is better to come in every 2 weeks. But I think people can do. I've had models on training before. People are getting amazing results just after just 2 sessions. You can see the difference after just 1 session. So I suppose it is just patient and case dependent. So yeah, it would be 6 sessions in total.
Yeah. Someone's asking, so I used HMW 4 sessions. So we actually did Jalupro Super Hydro. We did 4 sessions of Jalupro Super Hydro to ligament first. Then we did 4 sessions of HMW, and then Classic. We did them 2 weeks apart. Each session was 2 weeks apart for the whole Jalupro range. I hope that's clarified that.
I think that's pretty much everything. Obviously, we can share the study, so you've got the exact protocol. Obviously, did win an award globally. Oh, someone just put, so what cost would this be to a client? I understand this. Yeah, I think because Kelly's based as well in, we've got to remember Kelly's based in Wales, so obviously this will differ from central London pricing. We do have a regional sales team, and also an amazing customer service team. So we can usually obviously advise a little bit on pricing, but that is obviously something that yourselves have to decide and where to price your products based on.
I tend to, so on my price list, one session of Jalupro Super Hydro is £250, and they get the face mask and the LED. However, we explain how the injectables work and how it's for best results to do at least a course of 3. So I tend to do a course of 3 for £600. I know my colleague Dr. Natalie charges £800. However, she's in a completely different region to me. So yeah, it differs from place to place, really.
I think based on what Nikki just said as well, I completely understand that that's really, oh no, so it wouldn't be probably 12 sessions around the mouth. This would be like the old, so what Kelly did was her patient obviously taken into consideration age and that this was going for an award. I think what Kelly's delivered is the optimal Jalupro case study. So if you could, you know, have the patient wanted to, you know, invest in everything, that would be the optimal outcome from the products. But obviously there are other options, and you get people having standalone Jalupro with great results.
So if your patient didn't have the budget to do this whole protocol, you could do
HMW, Nikki, for the mouth.
Yeah, you could give them some filler. You can give some standalone hyaluronic acid to give them if they wanted to go down the filler route, and then support the skin using HMW or plastic. So
yeah,
you know, you can incorporate it into the treatments you already do as an add-on. Just advise the patient that to get longer lasting results from your filler, you need to be thinking about amino acid replacement therapy.
Also, obviously, polynucleotides are sending a signal to the cell, whereas obviously with amino acid replacement therapy, we're feeding the cell. So I know polynucleotides are a huge buzzword in clinics as well. So they both work great in combination. What I will do is, because I've got the recording, I'll try and hand this over to our customer service team, who can get back with protocols and get in touch with kind of a follow-up email, which is normally sent out after the webinar. As Kelly said, thank you all for tuning in. I've popped in the training link with the LAM, so if you search amino acid replacement therapy, the LAM, obviously the education can continue with a training session, which we'd all love you to be trained on Jalupro. We've also got a lot over on the socials, but yeah, we're more than happy to answer any questions and things like that. So please do bear with us, because it's been quite a popular webinar. Thank you to Kelly. So yeah, we'll get back to you all with that. Hopefully you can download the brochure off the link that I sent in as well.
Thank you so much for listening, everybody.